Amendment to this title, and has it been available for 2 hours or more?
It has.
Amendment qualifies. Clerk will report the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Murphy of Connecticut. Add at the end of subtitle C of Title 7 of Division B the following.
Without
Section
objection,
17.
the amendment is considered as read. The gentleman from Connecticut is recognized.
Thank you, Mr. Chairman. Mr. Chairman, we've heard from a lot of our providers and hospitals back in our districts about the two-tier medical system that often exists, with Medicaid being an incredibly poor payer for many of our providers and hospitals. This has a direct federal nexus because normally we're paying about 50% of Medicaid costs, and under this bill we are going to be bearing an even greater responsibility for paying Medicaid claims, in addition to the new money put in the stimulus bill. There is in existing federal law a requirement that states pay rates sufficient enough to guarantee an adequate network for those participating in Medicaid. Unfortunately, the federal government really doesn't have the information necessary to do an assessment of whether those networks are sufficient and whether the states are paying enough to our providers and hospitals to get them to join in. So this amendment is fairly simple.
Gentleman yield. We're prepared to accept the amendment on the minority side.
I thank the ranking member, and I'll yield back.
Any further discussion on this amendment? If not, we'll proceed to the vote. All those in favor of the Murphy amendment say aye. Aye. Opposed, no. The ayes have it, and the amendment's agreed to. Who do we go to?
Dr. Gingrey, if he's here.
Mr. Gingrey?
And then we were going to go to Dr. Burgess, and he's not here.
Okay.
Let's
Well,
see who is here.
Well, you're going to do your premium assistance form?
How about recognizing
Mr. Barton, for what purpose do you seek recognition?
I have an amendment at the desk, number BENECHOICE, Ben Choice 001. It's a Barton Deal Premium Assistance Amendment.
Read it so we
Let me inquire before I recognize this amendment.
It's been at the desk for several weeks.
And is this to this title?
It is to this title.
Okay. Clerk will report and read the amendment.
Amendment to the amendment in the nature of a substitute to H.R. 3200 offered by Mr. Barton and Mr. Deal. Add at the end of Title 7 of Division B the following new subtitle. Subtitle 1, Beneficiary Choices under Medicaid and S-CHIP. Section 1781. Easing
Without
administrative...
objection, the amendment will be considered as read. Mr. Barton, I recognize you.
Thank you, and I'm going to also recognize Mr. Deal, who is the co-author of this amendment. It's fairly straightforward. It would provide every low-income American the right to choose the health care coverage that best fits their needs. It prevents the creation of a two-tier system. This would accomplish the goal of letting people who are low income pick the care package that's best for them, because it would provide citizens who are on Medicaid or S-CHIP the ability to choose the premium assistance program, to use the premium assistance if they're working, so that they could keep their employer-sponsored insurance. If they don't have employer-sponsored insurance, they would get a voucher that they could then use to choose from a long list of high-quality private health insurance programs, so that they could pick the plan that they want that way. If we don't adopt this amendment, the underlying bill creates a two-tiered health care system that allows families making over $30,000 per year the ability to choose from potentially hundreds of different packages, but would deny low-income families that same choice. I'd be happy to yield to Mr. Deal for any comments that he wishes to make.
I thank the gentleman for yielding. Obviously, as the ranking member has explained, what this does is, rather than falling under the provisions of the underlying bill that automatically enrolls a person or a family that is 133% of poverty and below, which would automatically enroll them in a Medicaid program. If they are employed and have a health care benefit through their employer, this would provide the option of a sum of money that would allow them to pay their costs to participate in their employer-sponsored plan rather than being automatically enrolled in Medicaid as the underlying bill calls for. In other words, a family that earns $30,000 a year, a family of four, would retain the right to choose what health care they would like to participate in. If you're at $29,000 plus of a family of four, you have no choice. You will be automatically enrolled under the underlying bill in a Medicaid program, even though you might prefer to have some financial assistance that would help you stay in your employer-offered plan. I would urge the favorable consideration of this amendment.
Gentlemen, yield to me, because I keep on getting talking points on the wrong amendment.
It's his time.
Mr. Barton, it's your time. This amendment, could you clarify exactly what this amendment would do?
You want me to clear? It simply creates the ability for people that are eligible for Medicaid and S-CHIP, if they're working, they'll get a premium if they want to keep the health care they have where they work, or take it if they don't have it. They would get premium assistance from the government to participate in that plan. If they are not working or they don't have health care where they work, then they would get a premium assistance voucher to choose a number of plans in the marketplace that meet the Medicaid and S-CHIP requirements, and then they would have the choice to choose which plan best fits their needs.
So you would let them choose between their employer-sponsored health care or not participate in that and go on to Medicaid?
Well, we would give the choice to the beneficiary.
Yes.
They would not have to automatically go into some public plan option. They would have the option of either getting premium assistance where they work, if they had chosen not to participate in the plan where they work because they couldn't afford the co-payment. They could go into a plan in the private sector that was not at work, and again, they would get premium assistance for that. Or if they wanted to go into some public plan option, that would be their choice. Now, that's my understanding. I'm going to yield
Yes,
to Mr.
thank you for yielding. What it does is it requires states to offer this option, and it applies both to Medicaid and to S-CHIP. Take, for example, a child who may be in the S-CHIP program, but the parent has an employer-sponsored health insurance plan. This would allow that parent to get the financial assistance to be able to pay the cost for keeping their child in their employer-sponsored plan rather than being shifted into S-CHIP, or for the individuals who are Medicaid eligible, having the same thing happen to them to be automatically enrolled. It simply requires the states to offer the premium assistance as an option. It does not require them to actually accept it one way or the other.
Mr. Chairman.
Gentleman's time has expired. Mr. Palome's recognized.
Mr. Chairman, I'm not questioning the intent of the authors of this amendment, but I'm concerned of the consequences, because basically we have protections now under CHIP that ensure that children have adequate benefits and affordable cost sharing, and that ensure that premium assistance does not increase federal costs. But the way I understand this, that for the first time, CHIP funds, and I use CHIP as an example, could be used to enroll children in private coverage that provides scaled-back health coverage for children, charges deductibles and co-payments that low-income families may have difficulty affording, or costs more than it would cost to enroll the children directly in CHIP. Now, I understand that this is an option. At least that's what I know the authors are saying, and I take them at their word on that. But even though it's voluntary for parents, I think low-income parents may have a lot of difficulty understanding all the differences between the benefits and the cost-sharing requirements under the private coverage option and under the state CHIP program. So you could have significant numbers of low-income children that could end up in health plans with fewer benefits and substantially higher cost-sharing charges, and basically be significantly worse off than current law. I mean, I know how difficult it is myself just trying to sift through all these different things. And even though you're giving people the option, I think there can be a lot of confusion. And I'm just very concerned. I think that, you know, we do have premium assistance options under the CHIP program, but this would basically change things so we wouldn't have these guaranteed protections, and that would be my concern, and that's why I think that we should not support the amendment. At least that's one of the reasons.
Is it our time or?
No, it's Mr. Pallone's time.
Okay. Would the gentleman yield?
Yeah, I would yield, sure.
Okay, first of all, we have a limitation that there's no additional out-of-pocket expense to the federal government or the state government. So this doesn't cost more. Second, what we're doing is trying to empower people. We're trying to, as Chairman, as Ranking Member Deal said, the only shall in here is that the state shall give this as an option, but the option remains with the individual. The option is not with the state. In other words, if an individual family can get better coverage for their children or themselves and they qualify for Medicaid and or SCHIP, we're trying to empower low-income Americans. Now, I happen to think that low-income Americans are as smart as high-income Americans. The fact that they're low-income may be lack of education, it may be a physical handicap, it may just be bad luck, but that doesn't mean that they don't have the ability to differentiate what's best for themselves and their family. This is an optional thing. It doesn't cost more money. The only shall is that we say the states shall offer the ability for people to choose.
But let me say, I don't understand what you're accomplishing. The concerns that I have, I don't think are adequately addressed by your response, because I don't know, it's hard for me to assess, looking at this language, exactly how, you know, some of these protections that you're suggesting would work. I know that the existing protections are strong, and I would be afraid that we would be losing them. And I don't really understand what we're accomplishing. The bill, the SCHIP bill that we adopted and signed into law this year does give states the opportunity to provide premium assistance to CHIP-eligible children whose families have access to employer-sponsored insurance. But the main thing is that the bill ensures protection that they continue to receive adequate benefits and have affordable cost sharing. I don't see what you're accomplishing with this, and I would be fearful that it might break down some of these protections without actually accomplishing anything. That's my concern, Mr. Chairman. I yield back.
Gentleman yield.
I yield to the gentleman from Texas.
Mr. Pallone, let me just ask you some questions, and maybe we can get answers. I'm concerned about this because if we're concerned about the cost of Medicaid and SCHIP under the bill as a whole, just allowing folks the option to take that amount of money and go under Medicaid or SCHIP would still have the cost issue in there. But in our history, though, and you'll remember, our committee created the Medicare HMOs in the 90s that were supposed to be less than the average cost of Medicaid. And now we know that Medicare Advantage is 15% more than the average cost of Medicare. So that's my problem.
I think the gentleman is correct. And remember, this program, you know, we only passed this bill, signed into law, not even 6 months ago. And, you know, I think that to make these changes now with all these concerns, it just doesn't make any sense, Mr. Chairman.
Gentleman's time has expired.
Mr. Chairman,
Yes, Mr. Deal's recognized.
I asked to strike the requisite number of words. Mr. Chairman, let me clarify for my colleagues on the other side who don't understand the amendment. It's the difference between coverage and access. 96% of all doctors accept private insurance. Less than half of the doctors in this country accept Medicaid. If a family is going to be automatically enrolled under your underlying bill in Medicaid with no choice, and have less than half of the doctors in the country willing to take them as patients, versus giving them a subsidy so they can stay in their employer's Blue Cross plan, for example, and get 96% of the doctors in this country to treat them and their children, that's the difference. We've had great difficulty explaining to y'all the difference between coverage and access. This is a bill, this is an underlying amendment that addresses that very clearly.
Would the gentleman yield just briefly?
Yes, certainly.
I mean, I understand where you're coming, but we do have a premium assistance program that allows that to happen with the protections that I expressed. So, you know, why is it that you want to so quickly move away from that? I mean, it does exist now. We, you know, in the bill that we passed, there is the option.
You're talking about S-chip bill?
S-chip, yeah.
Talk about Medicaid. Don't know that you've got one there. This applies to both S-chip and Medicaid. If a family has a child enrolled in S-chip and they like it, they are certainly free to do it. There's nothing that mandates in this amendment that they have to change. It's simply an option, and it's an option that relates to access to coverage, access to health care rather than just the broad issue of coverage. I would yield to the ranking member.
Just want to point out, this was part of our alternative package to S-chip 2 years ago. It's not a new idea. We're simply taking the existing mandates, either in current law or in the bill, for coverage. We're taking the existence, the existing states' obligations. We're taking the existing funding. We're not changing any of that. We're simply trying to empower low-income Americans who qualify for S-chip for their children or Medicaid for themselves, and give them the option, if they want to enroll in a different plan than the state-sponsored Medicaid or S-chip plan, and that plan qualifies and doesn't cost them any more, the federal government and the state government, more out of pocket. They can do that. That's all this does.
Gentlemen, yield to me.
It's Mr. D.
I would yield.
Now, as I understand your amendment, rather than allow a state to do what it can do now under Medicaid, which is this premium support idea, you would require a state to have a premium support option. And is that right? You would require states?
It would require them to offer it as an option.
Okay. Now, could that mean that a child from a low-income family could be talked into the idea of having their child go into what's called a health opportunity account, where you have to come up with the costs for your care, but then you get catastrophic coverage?
Reclaiming my time, I don't believe that that is included within the underlying bill. But the issue here is, yes, this amendment requires states to offer this as an option. Under the language that Mr. Pallone was referring to, the existing law, states are not required to offer an option. They can if they choose to, and I'm not aware that any, maybe some, but not very many states have actually offered that. This would put this on the table as an option.
But the direct answer to the chairman's question, we don't change the requirement that state plans or private plans meet certain minimum standards. So if that type of a plan met the standard, then the answer is yes. If it doesn't meet the standard, the answer is no.
That's true, as long as the underlying bill language remains the same.
Gentlemen,
That's
yield to
correct.
me. If the states have an option to provide this premium support for Medicaid children, why do you need now to tell the states they must do it? If the states haven't done it, it's because they don't think it's a good idea to make the option available for kids to be signed up in a plan that won't be as generous as Medicaid.
Well, because the basic thing here of choice should rest not even at the state level, but the choice should rest at the parent's level. And this is what this would require, a parent being given that choice as to what's best for them. Okay. And I would yield anyone else.
Your time has expired. And to take the last 5 minutes, I'll recognize myself. The reason I oppose this amendment is that we allow states the choice to take the Medicaid children and to allow their parents to put them in a private insurance plan. That's now available for states. This would require them to do it. Well, why wouldn't they do it if they're allowed to do it? Well, I could see a number of reasons. We're empowering a lot of low-income people to be taken advantage of by salesmen who will say, don't stay with S-chip or Medicaid, come to our private insurance plan, it's going to be better. Well, then they sign up in a private insurance plan, and it's not better. We know what they get under Medicaid. We know what they're going to get under S-chip. It's guaranteed. But if they sign up in a private insurance plan, the out-of-pocket costs could be far greater, the benefits may not be as generous, and then people are stuck. Now, we don't deprive the states under existing law to offer this, but I think that they don't want to offer it, and we should not require it. I'm always interested in the language that we empower people to make the decision, not the states. But we're talking about people who may not be as sophisticated. I know many of my friends are not sophisticated in trying to decide between insurance plans, but some of these people that are on Medicaid or S-chip are particularly vulnerable. One option for insurance coverage would be to say, oh, you ought to sign up your children in a health opportunity account. That would be offered by the states immediately, and this amendment would even prohibit a GAO evaluation of these accounts. Well, on a strongly bipartisan basis, as part of the CHIP authorization law, Congress prohibited the Secretary from allowing any additional states from using health opportunity accounts. Now, why would they do that? Well, these states could enroll Medicaid beneficiaries into high-deductible health insurance plans. They could give the argument, you sign up your children in this health opportunity account, and they can have catastrophic coverage, and then they can have some money to build up to pay for their primary care costs. But then if their primary costs exceed what's in their account, they may not be able to come up with the money to pay for the children to get the basic services before there's any catastrophic trigger. So I don't think we're empowering people. I think we're allowing
Mr. Chairman,
the opportunity for children and their families to be taken advantage of, and we have the state option. I wouldn't want a state requirement.
Mr. Chairman, would you yield?
Yes.
Mr. Chairman, I appreciate you yielding, and I know that you weren't implying that the poor are intellectually unsophisticated and don't have the ability to pick and choose a plan wisely. And I would say that under the precepts of H.R. 3200, if this bill becomes law, when you've got all these comparative effectiveness research councils, and indeed if you have a public plan that's not only a competitor but also setting the rules and deciding what the private plans, what minimum standards they have to meet. I think you just said that you were concerned that maybe these because of lack of sophistication, that the poor would pick a plan because some sharp shyster salesperson would sell them a bill of goods, and that they would get less than they would get under the current
well, let me
Medicaid
reclaim my
plan.
time because I only have less than a minute. I do believe that people can be misled in trying to choose between insurance options. And as a result, they could end up choosing an insurance option that we know will be a disadvantage to them. For example, these health opportunity accounts, they reduce the beneficiary access to needed care because low-income individuals and families would have to meet a high deductible before their services are covered. Because states are not required to contribute enough funds to the account to fully offset the high deductible, many low-income beneficiaries are unlikely to be able to afford the remaining deductible. Well, that could actually increase federal Medicaid costs, because even though they've always been touted as producing savings, they raise the cost by allowing individuals to keep any account funds after they are no longer eligible, and to use such funds to pay for higher provider rates than under Medicaid and to purchase non-medical services. So I just think that we're running too great a risk that people will end up in something that doesn't fit their needs, and it could end up even increasing the Medicaid costs.
Mr. Chairman,
Yes.
I would ask unanimous consent that you be granted 30 additional seconds, and I would ask you if you would yield to me.
Without objection, I'll be, without objection, 1 additional minute.
That's good.
And I'd like to yield to the gentleman from Georgia.
Thank you very much. And I'd like to ask counsel, under the underlying bill, when are Medicaid beneficiaries allowed to choose a plan under the exchange?
I don't believe that they are.
They never.
For the current population, there is a very small group of new eligibles, referred to colloquially as Miller eligibles, are people who were previously in a plan who can continue to stay in the plan.
But for those that will be enrolled in Medicaid under the existing underlying bill, they will never be eligible to choose a plan under the exchange that has been so highly touted in this bill.
With the exception of that population, you're correct.
Thank you. I would yield.
Well, I'll take my time back. People in Medicaid will stay in Medicaid. At some future time, we may try to allow them to go through the choice through the exchange, but at the present time, we want to make sure they have their health insurance, and Medicaid provides that, and it turns out to be even less expensive than putting them into the exchange. All time has expired on the amendment. All those in favor of the amendment will say aye. Aye. Opposed, no. No. The noes have it. The amendment's not agreed to.
Roll call vote.
Clerk will call the roll.
Mr. Waxman?
No.
Mr. Waxman, no. Mr. Dingle? Mr. Markey? Mr. Pallone? Mr. Pallone votes no. Mr. Gordon? Mr. Rush? Ms. Eshoo? Ms. Eshoo votes no. Mr. Stupak? Mr. Stupak, no. Mr. Engel? Mr. Green? Mr. Green votes no. Ms. DeGette? Ms. DeGette, no. Mrs. Capps? Mrs. Capps, no. Mr. Doyle? Mr. Doyle, no. Ms. Harmon? Ms. Harmon, no. Ms. Schakowsky? Ms. Schakowsky, no. Mr. Gonzalez? Mr. Gonzalez, no. Mr. Inslee? Mr. Inslee, no. Ms. Baldwin? Ms. Baldwin, no. Mr. Ross? Mr. Weiner? Mr. Weiner, no. Mr. Matheson? Mr. Matheson, no. Mr. Butterfield? Mr. Butterfield, no. Mr. Melanson? Mr. Melanson, no. Mr. Barrow? Mr. Barrow votes no. Mr. Hill? Ms. Matsui? Ms. Matsui, no. Mrs. Christensen? Mrs. Christensen, no. Ms. Castor? Ms. Castor, no. Mr. Sarbanes? Mr. Sarbanes, no. Mr. Murphy of Connecticut? Mr. Murphy, no. Mr. Space? Mr. McNerney? Mr. McNerney, no. Ms. Sutton? Ms. Sutton votes no. Mr. Braley? Mr. Braley, no. Mr. Welch? Mr. Welch votes no. Mr. Barton? Mr. Barton, aye. Mr. Hall? Mr. Hall, aye. Mr. Upton? Mr. Upton, aye. Mr. Stearns? Mr. Deal? Mr. Deal, aye. Mr. Whitfield? Mr. Shimkus? Mr. Shattuck? Mr. Shattuck, aye. Mr. Blunt? Mr. Blunt, aye. Mr. Boyer? Mr. Boyer, aye. Mr. Radonovich? Mr. Radonovich, aye. Mr. Pitts? Mr. Pitts, aye. Ms. Bono Mack? Ms. Bono Mack, aye. Mr. Walden? Mr. Walden, aye. Mr. Terry? Mr. Terry, aye. Mr. Rogers? Mr. Rogers, aye. Mrs. Myrick? Mrs. Myrick, aye. Mr. Sullivan? Mr. Sullivan, aye. Mr. Murphy of Pennsylvania? Mr. Murphy, aye. Mr. Burgess? Mr. Burgess, aye. Ms. Blackburn? Ms. Blackburn, aye. Mr. Gingrey? Mr. Gingrey, aye. Mr. Scalise? Mr. Scalise, aye. Mr. Engel? Mr. Engel votes no. Mr. Markey? Mr. Markey, no. Mr. Gordon? Mr. Gordon votes no. Mr. Ross? Mr. Ross votes no. Mr. Hill? Sorry. Mr. Hill votes no. Mr. Space, how are you? Mr. Space, no. Mr. Whitfield? Mr. Whitfield votes aye.
So we're trying to not cost anybody any extra money at the state of the feds. We're just trying to give individual choice. We're not trying to screw around with
Have all members responded to the call of the roll? Any member wish to change his or her vote? If not, the clerk will tally the vote and announce it when it's ready.
Mr. Chairman, on that vote, there were 21 ayes and 33 noes.
21 ayes, 33 noes. The amendment's not agreed to. Ms. Christensen, do you have an amendment you wish to offer at this time?
Thank you, Mr. Chair. I'm offering an amendment that consists of two related amendments to the medical home provision.
You're combining it as one amendment.
Yes.
Clerk, Clerk will inform us whether this is to this title and has been available for 2 hours.
10 days.
It has, Mr. Chairman. It's
Clerk will report the amendment.
amendment offered by Mrs. Christensen of the Virgin Islands in subsection D4 of section 1866E of the Social Security Act, as added by...
Without objection, the amendment will be considered as read.
Mr. Chairman, may I make an inquiry? I don't know whether it's of council or parliamentary. Is it possible to know, are these two amendments substantially related, or are they different enough that we ought to consider them individually?
It doesn't make any difference. If somebody offers an amendment, it could be, they're both to the same section of the bill. They don't have to be anything more than that.
Well, let me ask you this. To offer them as an en bloc amendment, do you need to ask for unanimous consent to combine them?
No, because the amendments have been at the desk, and we had a previous unanimous consent request, or if not that, we've had an announcement that members may, it wasn't unanimous. We had an announcement that members may offer and combine amendments that had been in the desk into larger amendments.
parliamentary inquiry.
Gentleman's state his inquiry.
And this is a good example, because in this particular en bloc, there's one of them that we're prepared to accept and one that we're not. What's the requirement under the rule to ask for a division of the amendment? Is it up to the author, or can any member ask for division of the amendment? The chairman's...
I'm trying to get an answer to give you a correct one. No, are you chair the...
Yeah, it's a privilege
to divide?
Yeah, I mean, so someone can request a division, that's a
Simple amendment.
Mr. Barton, I'd have to check in more detail with the parliamentarian, but Mr. Wiener, who has chaired the House floor on many occasions, has informed me that in his experience, whenever a question is raised to divide an amendment and consider parts separately, that it would be a privileged motion. I would think that if you want to divide a question if you ask unanimous consent, I don't know why anybody would object to it.
Well, Mr. Chairman, with that parliamentary explanation from the distinguished gentleman from New York, I would ask unanimous consent to divide the amendment pending Mrs. Christensen into 2 amendments.
Without objection, that will be the order, and the chair wants to reserve his comments as not an absolute commitment on the parliamentary procedure, because I would want to clear that with the parliamentarian, but by unanimous consent, we can certainly divide the question, and I would think it'd be appropriate if members want to consider them separately.
And then I would...
What is the one you like?
We will accept Christensen 001.
Ms. Christensen, give us a sentence or two on that before we accept it.
Sure. It just inserts that the secretary shall, rather than may, seek to eliminate racial, ethnic, gender, and geographic health disparities through the use of medical homes.
I can't see why anybody would object to that. Let's go to the vote on that particular part of the amendment. All those in favor say aye.
Aye.
Aye. Opposed, no. The ayes have it. The amendment's agreed to. Gentlelady is now recognized for 5 minutes.
Chairman, reserve a point of order.
The gentleman reserves a point of order on her second amendment.
Thank you, Mr. Chairman.
second
And I
part.
can't understand why anyone would object. This is another very simple amendment. It was combined because they're both within the medical home provision. And it just would say, it says that the secretary shall, among the pilot programs, select one that would go in a territory. Not one in every territory, but at least one in a territory. The territories have very unique circumstances, high healthcare costs. They have high incidence of chronic disease and complications from that chronic disease. And as American citizens who happen to live in offshore areas, we feel that it is important for us to participate in this program, and it would really be a big help to us in getting control over problems such as diabetes. I believe Guam has one of the highest incidence of diabetes in all of the United States and its territories. The Virgin Islands is pretty high as well. And we're faced with end-stage renal disease that we're finding difficulty accommodating space for. So I would hope that my colleagues would recognize the fact that we are a part of this country and would support this amendment that just says that among the pilot projects, we'd like to have one in one of the territories.
Gentlelady, yield to me.
Yes.
As I understand it, the territories have never had any of these pilot projects in the past. And we want to learn from these efforts. And I think that it's only reasonable that we make sure that the territories are not neglected in the awarding of these efforts to eliminate racial, ethnic, gender, and geographic health disparities. I think it's a good proposal, and I certainly would join you in supporting it.
Thank you, Mr. Chairman. And if I could just reclaim my time and the rest of the territories, because even though some are in the Pacific, some are in the Atlantic, some of the challenges we face are the same, so we could all learn from that one pilot program.
Thank you. Mr. Barton?
Mr. Chairman, I rise in respectful opposition. I'm obviously not opposed to a territory being chosen as a home of one of these pilot programs, but by the same token, I think whoever makes those decisions should be able to make them without being directed. What if the amendment was that it should be located in a state that begins with T, or in a state that was once a sovereign nation, or in a state, in a state that has on its flag a bear? I mean, there are all kinds of ways you can direct. I just think it should be an open process, and if it is the feeling of the Secretary of Health and Human Services or the Commissioner or whoever makes the decision that a territory should be chosen as one of these medical pilot projects, I'm all for that. I just don't want to direct that it has to be. So that's why I respectfully oppose the Second Amendment.
Any further debate? If not, let's proceed to a vote. All those in favor of the Christensen amendment say aye. Aye. Opposed, no. No. The ayes have it. The amendment's agreed to. Now, on the Republican side, Mr. Gingrey, I think you had an amendment?
Mr. Chairman, I have an amendment at the desk.
Yes.
I'd like to move to strike the last word.
I'd
just like to make an announcement from the chairman.
Without
of
objection, we'll recognize the gentlelady before we proceed any further, and probably have to go to the floor to vote soon.
Mr. Chairman, Mr. Dingell has just asked me to remind the members that this is the rule on the food safety bill, and that he'd like members, if they can, to go down and vote on the rule, and then if they'd like to speak on the bill, to let him know. Thank you very much, Mr. Chairman.
This is a bill that's come out of our committee unanimously.
If the gentlelady will yield.
The gentleman
for her
Texas is recognized.
Gentlelady,
Would you yield to Mr.
Republicans.
I'd be happy to yield.
Let me couch this. The ranking Republican supports the rule, because this is a bill that was reported by our committee that we have worked in a bipartisan fashion.
Thank
So
you.
we will vote yes on the rule. At least I will.
Okay. Mr. Gingrey, you have an amendment. The clerk will inform us whether it's an amendment that's been at the desk an appropriate amount of time and it's to this title.
It has, Mr. Chairman, yes.
As I understand it, the clerk will report the amendment.
Amendment offered by Mr. Gingrey of Georgia.
Without objection, the amendment will be considered as read. Recognize the gentleman from Georgia for 5 minutes.
Mr. Chairman, thank you. This is a very straightforward amendment and a very important amendment. It would prevent the Centers for Medicaid and Medicare and Medicaid Services from using federally funded clinical comparative effectiveness research data to make coverage determinations for medical treatments, services, or items under Title 18 on the basis of cost. Now, Mr. Chairman, we know that in the pay-fors for this $1.5 trillion bill, that hundreds of billions of dollars have literally been taken out of the Medicare system, not the least of which, of course, is the amount of money that's taken from Medicare Advantage, a program that some 20% of our seniors choose as their way of receiving health care under the Medicare program. And they make those decisions, of course, because of the fact that many things are included that are not included under point of service, things like preventive care and emphasis on wellness. So the concern that I have is that when crunch time occurs, and indeed it will, we heard the CBO last week talk about the fact that this bill will not bend the growth curve and the cost of health care in the right direction. In fact, it will increase the cost, that there will be rationing and there will be decisions based on the cost of a treatment, a medication, a particular surgery. And that's my big concern. And we have examples, Mr. Chairman, of that already in Commonwealth Care in Massachusetts, and certainly in TennCare in Tennessee some 15 years ago, as my seat mate, the gentlewoman from Tennessee, knows all too well. So this amendment just very simply says that the Center for Comparative Effectiveness Research data cannot be used by the Medicare-Medicaid system to deny a treatment based on cost alone. If we look at, I want to have my colleague hold this chart up for me. I think, Mr. Chairman, that this may be the organizational chart of the House Democrats' health health plan that Speaker Pelosi said we were not permitted, no member was permitted to use their franking privilege to send this to their constituents to try to help them understand this very complex, difficult 1,100-page bill. But in any regard, on this flow chart, or algorithm, I think you could call it, there are a number of areas in which these decisions could be made to deny coverage based on cost alone. Right here is Comparative Effectiveness Research Commission. And of course, over here is a healthcare provider, your physician. And way over there on the other side, Mr. Chairman, are the patients. This is, I think, something that all of my colleagues, I hope, would agree with. Let's take an example of someone.
Gentlemen, yield to me.
And I will yield. The chairman?
Yes.
Yes, I'll be glad to yield to the chairman.
I've looked over your amendment. I will vote for the amendment, urge others to vote for it as well.
Mr. Chairman, I appreciate that very much, and I want to yield just a few seconds to my colleague from Michigan, because I think it's important. The story that he has told before needs to be heard again, and I'm going to yield just a few minutes, or a few seconds, to my colleague from Michigan, Mr. Rogers.
Well, thank you, Mr. Chairman. I think at this time, since they've agreed to accept the amendment, I best keep my mouth shut.
Mr. Chairman?
I would suggest that we take yes for an answer and go vote on the floor.
Mr. Chairman?
Yes.
Agreed with a caveat that we don't have to see that chart anymore?
No, I'll tell you what, Mr. Chairman, I'm going to accept yes for an answer, but I want to show one more chart, and that I've been waiting for 3 weeks to bring this one up. Democratic health care reform, you can have whatever you want as long as the boss approves. Boss hog. That's from Hazard County, Georgia, and I yield back, Mr. Chairman.
Gentlemen, time has expired. Are we ready for the vote? All those in favor of the Gingrey amendment say aye. Aye. Opposed, no. The ayes have it. The amendment's agreed to. We'll now take another recess. We've got 4 votes on the House floor. Please return after the last vote.